Hey y'all, and welcome to our channel. My name is Tye, and I'm so glad you're here because that means you're interested in not only breastfeeding but in learning about it and learning about the benefits for mom and baby. So before we start, I do just want to let you know that I am not a medical doctor. I am not a lactation consultant. I do have a health background, and I am a mama of 8 to be exact. We are a blended family, so out of those 8, I gave birth to 5 and successfully nursed 4. Why 4? Because 1 just wasn't having it. She wasn't having it. She didn't want any parts of it. And that's okay too. So keep that in mind. Not all babies want to breastfeed or can breastfeed. So if you're having trouble breastfeeding, you can always talk to your doctor, your local La Leche League, your local lactation consultant. Many hospitals, when you deliver, will have a lactation consultant on hand for you to speak to. If not, you can always ask for one. So that's a big thing too. Don't leave the hospital with questions, not knowing how to properly latch or having questions unanswered, because then when you get home, it's going to be a big change. If you're a first-time parent, or whether you're not a first-time parent, bringing a new baby into the home and learning how to breastfeed and successfully latch that baby on can be stressful at times, because you've got to get it, baby's got to get it. You've got other children possibly that may need attention. Dad may be feeling a little left out, so that's another thing too. But there's tons of ways to incorporate dad into the picture. He can change pampers, he can burp baby, he can do skin to skin. If you decide to pump just for dad, that would be fine too. That way dad can feed baby a little bit of milk. That way he feels included. So let's start at the beginning. There are many benefits to breastfeeding, such as breastfed babies get fewer ear infections. They get sick less often. They have less risk for allergy and asthma. So definitely keep that in mind. Those are definitely wonderful benefits. And breast milk has over 2,000 nutrients in it. It's ready on demand. There's no heating, cooling, warming, of course, unless you decide that you're going to pump, and we'll just discuss that later. There's many benefits to mom too. It could possibly delay your period if you exclusively breastfeed. So that's always a bonus, right? It helps our bellies shrink faster. It helps us lose weight quicker, which is always a plus, because that baby weight sometimes just will not come off. Some women may develop colostrum earlier than others. It may come in well before you have the baby. It could be come in months before you have the baby, or even weeks, and that's fine. It's not an indication on whether you'd be able to breastfeed or not, or how well your breastfeeding journey will go. Just like the size of our lady parts. I'm not exactly sure what I can and can't say on YouTube, so if I refer to these as lady parts, just you know what I'm talking about. The size is not an indication on how well you'll be able to breastfeed, or if you will or won't be able to breastfeed. So I know that's a big worry too for women that are smaller chested, or for women that are bigger chested. It's not an indication on how well you do, or if you would be able to. Just to reiterate that. If you have questions, of course, you can always talk to lactation consultant, your OBGYN, pediatrician, or maybe a friend or family member that's breastfed before. Or you can come here and I'll answer any questions you have. So let's start off with colostrum. So your colostrum, once it comes in, it may be yellow, it may be whitish yellow, and this is what's going to come in before your milk. This is what's going to give baby lots of nutrients and everything it needs before your milk comes in. So don't worry if it takes, a day or 2 or 3 to come in. As long as you're producing that colostrum and baby's getting it, baby has all he or she needs. Not only that, but baby's belly is very, very small, the size of a cherry. So we're thinking, something along this. So some babies, breastfed babies, will cluster feed. So what that means is they're feeding often. It could be every hour. It could be every 30 minutes, because their bellies are so small. They're not taking in much, so they may be hungry more frequently, or they may just be nursing for comfort. So keep that in mind too. It doesn't always mean just because your baby wants to nurse, it doesn't mean that the baby's hungry. It doesn't mean the baby's starving. It could just simply be the baby just wants to suckle, or a baby just wants comfort. So an indicator of whether baby is getting a good amount of milk or not is wet diapers, poo-poo diapers. That's how you know baby's getting a good amount of milk. As long as they're using the bathroom on the regular, every time you change the baby, their poop and or pee, that's a really good sign. And as long as baby is holding weight or gaining weight, that's a good sign. Now, with breastfeeding, you don't want to introduce a passy too soon because it could cause confusion. Now, just from my experience, I've had babies that I could introduce the passy to right away and they'd be fine. I've had other babies where I introduced the passy right away and they immediately were confused. And by confused, I mean they'd get frustrated because they didn't know which was the passy and which was the nipple. And they would, suckle and suckle on the passy and nothing would come out, and they get frustrated and not want it. So then when you try to offer the breast for comfort, they wouldn't want it and they'd just cry. So that's an example of how they may get confused. So it's said that you shouldn't introduce a passy or a bottle until you and baby have got breastfeeding down and you've got, a good rotation going. You both know what to do. But I understand that's not for everybody. Some babies literally will want to be on the breast all day, every day if they could. And that's just, sometimes us mamas are not able to do that. We may have other kids or other things that we're doing. So you may choose to introduce a bottle sooner or a passy sooner, and that's up to you. It's your decision. So keep that in mind too. It's not all, one fits all kind of thing with breastfeeding. It's not. Something that may work for one child may not work for another child, or something that may have worked for one of your friends may not work for you. So really, you just got to go with what is good for you or what's good for your baby. So kind of just have to learn, your baby and their cues and how they are. And, if you need to introduce it, go ahead. And if you see that they're confused, if it's causing problems, then just take it away until they're better able to tell, distinct one from the other. What you want to look for is hunger cues. So that's a big thing too. A lot of people get that confused and they say, well, baby's not hungry because baby's not crying. Crying is a late cue. And by that, what I mean is when baby's hungry, they may suck on their hands, on their fingers, on their feet. They may lick their lips. They may suck on their lips. They may root, which is them just, looking for the breast or looking for the nipple. And if you see that they're licking their lips, they're smacking, they're, moving their head like they're looking for something, definitely offer the breast. And if they don't want to take it, that's fine. They don't want it. But most of the time, if they're showing them those signs, it means they're ready to eat. The problem with waiting too late to try to nurse is that once they start crying and they're upset, it may be harder for them to latch on, or harder for them to accept, that you want to feed them, because now at this point they're upset, and if you have a screaming baby and you're trying to latch them on, they may not want to latch. They may not be able to because they're so upset. You want to try and feed the baby about 8 to 12 times in a 24-hour period. But of course, talk to your doctor, because your doctor may suggest more, your doctor may suggest less, but that's around what's normal for 24 hours. Now, keep in mind, like I said, your baby may cluster feed, which means they may want to be on the breast every 30 minutes. So in this case, you're going to will surpass that 12 times. And from experience, our Jonah, who's 11 months now, he definitely cluster fed. He was different than the other 3 that I breastfed. He was wanting to be on the breast every 30 minutes to an hour at first. So definitely keep that in mind. If you have someone around to help you with other kids, that would be a big benefit, because, sometimes or some days you're just going to be in the room with baby, with nothing covering your top part, because that's how often you're going to nurse, and it just makes more sense to do it that way. So keep that in mind when it comes to family members visiting too. If they want to visit right away, you have to put your mental health first, your needs first, and your baby's needs first. So if you know that your baby's cluster feeding and wants to feed every 30 minutes, you know, how is that going to go over with people that are visiting that want to hold the baby, and baby may be crying or baby may be fussy because baby just wants to be in your arms, just cuddled or nursing. So definitely just, you know, don't be afraid to say what it is that you need or that you want. And then once baby is, you know, out of that stage or out of that phase, then, you know, go from there. Babies may also cluster feed when they go through a growth spurt. So if you and baby have been on a schedule and then all of a sudden baby just wants to nurse more and more and more, it doesn't mean that your milk is no longer good. It doesn't mean that they're no longer getting milk. It doesn't mean that you're not producing enough. It just means that baby's going through a growth spurt and wants more. Well, this will happen several times before the baby's 1. They'll have several growth spurts, and several times where they may just want to nurse more. And how long you nurse is totally up to you. Of course, it's recommended for a year. Well, it really just depends on what doctor you talk to, because I've had my son's pediatrician tell me, you know, go a year. I've also heard pediatricians say at least 6 months. And I've had my OBGYN tell me 2 years. So it really just, it's up to you. For me, myself, he's 11 months and he still nurses. So he nurses on demand, but he also has solids at this point. So I'm kind of just going with what he wants. If he decides to self-wean, then that's fine. Otherwise, if he wants to go until he's 1 or 2, I'm fine with that too. So it's just, you know, what works best for you. Now, if you decide to go back to work, it is a good idea to get a pump. There are tons of pumps out there. There's Hakas, I think I'm pronouncing that right, and they look like this. Really squishy. You just connect it to the breast and it sucks down the milk. Or there are manual pumps. There are, you know, pumps that you can get that are just like hand express pumps. What we have, and I'll show you. This is what we have. And it's a no, I don't use it very often. I am a stay-at-home mom, so we don't do bottles, if at all, ever. He's maybe had a bottle of milk, I will say 3 times. He has bottles and sippies, which we usually just put water in them. But as far as milk goes, we do have a backup stash, an emergency stash for milk. So keep that in mind too. Whether you decide to go to work or not, you always want to have some on hand in the event that you have to leave baby with somebody. But like I said, you don't have to go out and buy a pump. If you just want to get something like this, that's fine. There's plenty of other things out there you can get, like shells, milk shells, breast shells. They basically just go slide into the bra and they catch the milk. So you can use that as well. Definitely go to cdc.com because there is a milk storage guideline on there, which I definitely highly recommend everyone do, because milk, depending on if it's freshly expressed, it can stay out for, you know, up to 4 hours and be okay. If it's in the refrigerator, it can be refrigerated for up to 4 days. If it's something that was frozen or thawed out, it's only good for 1 to 2 hours. Now, things are constantly changing, so definitely, like I said, just go check that out. Make sure that that's still what's recommended. But once baby, you know, once you give, okay, so let's say you pump or whatever, and you give baby milk in a bottle. Once baby drinks it, you don't want to put it back in the fridge and say, okay, it's good for 4 days. No. If baby doesn't drink it within an hour or 2, pour it out, dump it out. Another thing with milk is you don't want to put it in the fridge, or not in the fridge, but in the microwave. If you want to thaw milk out, usually what I'll do is just run it under warm water, or if you don't want to run it under warm water, you can place it in a bowl or a cup with warm water in it and let it kind of defrost that way. When you're pumping, you want to keep an ice pack on hand for milk storage, especially if you do decide to go back to work, or maybe you're out and about at a family member's house, or you have went back to work. you want to get something that's insulated to keep it in. Now this is just one of my boys' lunch boxes, but make sure it's insulated. You don't want to use something like this that isn't insulated, because it's not going to help keep that coolness in that you need to keep it cold until you get it back home. Now I do want to show you as well what storage bags look like. So this is what a breast milk storage bag looks like. Of course, there are many different brands, many different kinds. You can put the name of the baby, the date, the volume, the time. I usually don't do the name, obviously, but I do usually do the date, the volume, sometimes the time, because it's important. Because even though frozen breast milk can last quite a while, it used to be 6 months. I'm not sure if it still is. You may want to check on that, but it's still good to put the date. That way, you know, if it's surpassed that 6 months or whatever the time is, you throw it out. You don't want baby to use that anymore. When they're very young, like newborn stages, and they're not taking that much milk, don't fill the whole bag up, because baby's not going to drink that much milk. And once it's thawed out, you can't refreeze it. Do not refreeze it. And obviously it would just go to waste. So what I suggest is smaller amounts. So maybe an ounce or two, freeze that amount while they're little. But of course, if you do end up filling up one, that's fine. Just like I said, if it lasts 6 months, just wait to give that to baby when baby's a little bit bigger, or if baby can drink that much milk. That'll be fine. That way you're not wasting. There are many breast milk storage containers out there in the world and on Amazon that you can look into, and they'll hold these, or they'll hold these. Now, when you are freezing your milk, you want to make sure that you lay it flat in your freezer. You don't want to freeze it up like this, because then you'll have that big bulky milk right there. And I do have one just to show you what it'll look like. So this is what it'll look like if you lay it flat and freeze it. Now, if you don't want to go out and get a storage container, or can't, or just can't make it into the store, a good little hack that I learned is just take a gift bag, cut a hole in the bottom, and it'll just turn into like a little dispenser. So basically it would look like this. If I can get it straight here. And then of course you'd put the newer ones on the top, just so that you kind of have a system there. And make sure you date them, so that way you know which date you pumped it. So something else that we haven't discussed yet and went over is pumps. Now there's a bunch of different ones out there. As I've said, I know WIC used to help with pumps. I don't know if they still do, but a lot of insurances now will cover the cost of a pump. They may cut you a check, or they may just have certain ones that they allow you to choose from. Definitely take advantage of that. Even if you don't plan on using it, it's still good to have on hand, like I said, because you still want to have a backup method of milk for baby in the event that you have to leave baby or go to work or whatever the case may be. Some babies, like I said, will have trouble with latching. There are nipple shields out there that you can look into getting, and that'll just help the baby latch better. Not everyone needs these, of course. Definitely talk to your doctor about it and see if that's something that you would need. If you notice that the baby's having a hard time latching, or, you know, maybe because you're engorged or because you're swollen or inflamed, that's another thing to look for. If your skin or in that area is red, swollen, inflamed, it's hard, definitely go see your doctor, because what it may be is mastitis. Now, mastitis is just, it's inflammation. It's inflammation in the breast area from possibly, you know, you may have a clogged duct, or maybe you went too long without nursing on that side, or maybe baby just doesn't like that side. Some babies are like that. They'll nurse on one side and won't nurse on the other. I have one like that. None of the other babies were like that, but Jonah, he's like that. He prefers the left side and won't nurse on the right side. We've had instances where he may play with the idea, I'll say, of nursing on the right side, but will give me this look like, what you doing? You know that ain't the side we use. So then, you know, you either have to make the choice to, you know, possibly pump on that side or put the haka on that side, or, you know, just something to catch the milk. That way you're not uneven chested. But let me see, what else did we not go over? And I'm just taking a look at this paper here. I wrote down several notes just to keep me on track, because if I don't, we'll be here all day talking about breastfeeding. Definitely talk to your doctor about drinking. You know, if you decide you want to drink, if you have a wedding, a party, anything like that. I know over the years, thoughts and opinions on that have changed, so we're not even going to cover that. Just talk to your doctor about it, and whatever your doctor recommends is what you should go with. Like I said, make sure you're switching sides, rotate sides, and whatever works for you is what you should go with. When you're feeding baby, make sure you always bring baby to you. That'll save your back lots of stress and lots of problems. You don't want to be hunched over trying to feed baby, because then your back will hurt, and then it's definitely hard to take care of yourself or a baby with your back like that. So prop yourself up on some pillows. There are breastfeeding pillows that you can get, or just regular pillows. Make sure you have something to support your back. Make sure you have something to support baby. There are plenty of different holds out there, like football hold, cradle hold. I seen one the other day where baby was pretty much just sitting upright like this in nursing. So it's whatever works best for you. Like I said, every baby is different. You may have babies that love football hold and babies that don't like to lay down like that. There's a sideline position that lots of women do when they're laying in bed. I do not do that hold because I always worry about baby not being able to breathe and all that. So that's definitely something to keep in mind when you're nursing. Make sure baby's mouth and nose aren't blocked, that they're able to feed properly. When they're latched on, you want to make sure that their mouth is fully open and that the entire mouth is around the nipple and areola. It may not surround the entire areola, but as long as the mouth is covering the entire nipple and nipples pointing up, that's what you want, so that way baby can properly get milk. They shouldn't just be sucking around the nipple area. They're not going to get milk like that, and you'll have a very fussy baby. Something else to keep in mind is take care of yourself. You know, you just had a baby, your hormones are going to be all over the place. You may notice smells that you may have not noticed before. Not necessarily bad smells or stinky smells, just weird smells or different smells that you've never had to deal with. So make sure you take time for yourself. You know, if you've got to put baby in the crib for a little bit, or have dad hold the baby so you can wash up or just wipe down, especially this area here, it may be sore. It may be a little irritated. Definitely use lanolin cream if you need it, and that you can find that in the baby aisle. You don't need a prescription for it, and it just soothes the irritation and dry, cracked nipples. Believe me, it helps. Ice packs, if you need ice packs for them being heavy, or maybe pain from, you know, your milk coming in. Definitely keep that on hand as well. Some women prefer disposable breast pads because you may have leaking at first. Until your breast milk regulates, your breasts are going to leak. And that's where, you know, the haka comes in. There are hakas that are different from this. There are some that you place directly in the bra to catch the milk letting down. That way you're not wasting milk and you're not ruining your clothes. Or disposable ones work just as fine. You can pretty much find them on Amazon, I know, or anywhere else that has baby products that you shop online. Definitely stay away from putting any lotions or deodorants or powders or perfume in that area, because you got to think that's where baby is eating at. You don't want baby ingesting any of that or having lotions on or anything other than lanolin. Lanolin is safe for babies, so you don't have to worry about trying to put it on and then wash it off before baby eats. You can leave it on, it's perfectly fine. So some doctors too will tell you don't use soap in that area, in the breast area, just use water. But we as mamas know that that area needs soap from time to time. So Dove is really good. Dove Sensitive is really good for that area. And usually I don't even suggest wearing perfume or a body spray, or if you're a dad, cologne, because you gotta think baby's gonna be laying on you, and any little thing can break the baby's face out, can cause an allergic reaction. So either cover your clothes with like a nursing blanket or blankie, or just don't put on perfume, or use detergent that's too strong. You may want to use a free and clear detergent, or like a baby safe detergent. If you feel like, oh, I just have to put on perfume, I just have to put on cologne. Something I do, like when I put on body spray, is I'll put a towel over that area, you know, over that whole area, and just spray everywhere else. That way I know if he's laying in that area or on my chest, he's not breathing in all that stuff, and I don't have to worry about his face breaking out. Of course, now that he's older, it's a little different. So just keep that in mind depending on the age of your baby, or if you notice that your baby is breaking out a lot. Definitely keep that in mind. Your doctor may also suggest vitamin D drops for when they're little, because that's one thing that your breast milk may not have a lot of, is vitamin D. And they'll look like this. Now this one is, I don't know if you can see it, Cultural Baby Grow and Thrive. It's a probiotic with vitamin D. Probiotics will help the baby's digestive system and help them digest a little easier. There are also lots of drops that are for gas and constipation relief. So of course, always ask your doctor, your OBGYN, your pediatrician before giving the baby anything or before taking anything. But I've had doctors that recommended vitamin D drops and doctors that didn't. So it's strictly up to you, of course, on if you decide to give them or not, or decide to ask about them. One of the last things that we're going to cover is nursing. So nursing in public. I know this is a big thing for some people because they worry about what people think or what people say. In all actuality, it's up to you. Just do with what you're comfortable with. A lot of people wear 2 shirts, like a tank and then a shirt over it. That way you're able to cover your belly while still pulling down your top in nursing. Or a bigger shirt. Like I still wear a lot of my maternity shirts because of the fact that I do nurse. And I know if we have to go somewhere and I do have to nurse, I don't have to worry about carrying a big blanket or trying to put a blanket over his face or anything like that, because it's hard to eat like that, you know. If that's what you like to do, then that's fine. But I prefer just to wear 2 shirts or wear a bigger shirt. That way he's covered, that area's covered, and I'm fine. No one has ever said anything to me. I've never had an issue with it, but I know some people do. And I just want to point out to you that nursing is not illegal. In all 50 states, it is legal to nurse anywhere you want. So if somebody tries to give you a hard time about it, just let them know, hey, I'm feeding my baby. I'm doing what's right. I'm not breaking any laws. So nowhere, no one can tell you that you can or can't nurse your baby here or there. But keep in mind that a lot of places do have nursing rooms. Hospitals, doctor's offices, some stores, some malls will have nursing rooms as well. So just ask. And if they don't have one, sometimes they'll say, well, hey, you can nurse here. Or if not, just find a comfy place for you and baby. Right? Baby has to eat. So thank you guys for tuning in. Let me know if you have any other questions.